My name is Michaela, and I wanted to bring you through the journey of triple negative breast cancer when you are under 30. So I'm glad you found this video. I'm not sure how you found this video, but I'm glad you did. And I'm really excited to kind of talk about the things that I've been through. Hopefully those will be things that will help you. So, port surgery happened and I received chemo about a week later, a week and a few days later. So during the port surgery, after, they give you a prescription for a cream that you can put on the port to kind of freeze it a little bit. It makes it really cold. But it just kind of numbs your skin. That way when you are receiving chemo, you don't feel the needle go in. Some people can feel the needle every time they do chemo. Some people, it doesn't hurt them. Other people need the cream and the spray that they have. It's like a freezing, numbing spray. And I was, the first time I was so scared, I really just didn't know what to expect. And I'll talk about that in a minute. But so I, of course, picked up the cream, and they come in little tiny tubes. So I kept one in like a bag that I brought with me to chemo every week, and then I kept one in my car, and I kept some in the house. It just seemed like, as long as I had it somewhere, I was happy to have it. If I didn't need it, that was fine. But when you're scared, you just sometimes don't know the right thing. So that felt like the right thing for me, was to put it in every place that I could possibly be so that I wouldn't forget. And how the EMLA cream is what it was called, but how the cream is applied. So you just put a little bit, like like the size of like a dime, like this much, that much, very, very small amount. You just put it on there, and you kind of make it like really thick on there. And then you take a piece of like saran wrap, and you just put it over there, and then just put your shirt over it, and it should stick. It should stick right to the cream, and then your shirt will basically just kind of lay on top. And you would do that about an hour before you go to chemo, within an hour before you're going to go. And that way it'll be nice and numbed up. Okay, so the first day of chemo, I was pretty nervous. I really felt just so lost. I didn't know what to expect. I had what they call chemo care. It's this program that a nurse walks you through what to expect, but it's different to hear what chemo is like from somebody that's never been through it. So for myself, like I said, I didn't find very much information about what to expect with chemo. I hadn't really seen anything, and believe me when I tell you, I'm a researcher, okay? You give me a topic, I'm gonna go and research the hell out of it because I want to know. I joke all the time that I go down these rabbit holes of like, this is interesting, let me find out all this information. And I'm telling you, there's just not enough. There's not enough women who were young with triple negative going through the stages of what to expect. So I was scared, and maybe even having the information, I still would have been scared. I don't know. But this was my experience, so I'll just tell you about that, and you can take away what you want to take away. So the first day of chemo, I started every day of chemotherapy at 12 o'clock. So my regimen was 4 rounds of AC, which I will write out the whole name, azithromycin something. Okay. And then I had 12 rounds of Taxol. So I had 4 rounds of AC first, and then 12 rounds of Taxol. The 4 rounds of AC were every other week. The 12 rounds of Taxol were every week. So I chose to do my chemo on Fridays. At my job, every other Friday is like really busy, and then the other Fridays are not so busy. So I chose to do the chemo on the Fridays that were not so busy. So the first day of chemo, I chose to start chemo every day at 12 o'clock. And basically how it works is, at least at the place that I went to, they said, okay, this is the first day of chemo. What time would you like to start? So they did give me a little bit of leeway, you know, with the times, and they basically said like, okay, well, you can start on a Thursday or Friday. What do you want? So I chose Friday because I really wasn't sure how my body was going to react. I didn't know, you know, from all the research that I had read, everybody's so tired during chemo, and it's something that is, you know, totally debilitating. And again, I had to work. So my thought was, okay, well, if, you know, if I can just do this on a Friday, I have Saturday, Sunday off, I can relax on those days. So that was what I chose for my day. And I went in at 12 o'clock. So I live about an hour away from the facility because I live out in the country, if you can't tell. and so I would log off my computer every day around 11, and then at 12 o'clock I would be starting my chemo. It was really more like 12:15 after they kind of got everything set up, and then I would actually work from the location because we had Wi-Fi, which was amazing. So the first day of chemo, I said I was really scared. I really just didn't know what to expect. So I'm hoping that I can kind of describe it a little bit, and then I will post some pictures, and if I can find a video of that I had taken, I'll post that. So the first thing for me that I had to do was I went into the facility, and they take, sometimes they have to take blood and sometimes they don't, just kind of depending on the appointment. The first one though, I don't believe they took blood. I believe they'd taken it at an appointment that was a few days prior. They are looking at your white blood cell count. They are looking to just make sure that your numbers are going to be able to sustain you through at least that chemotherapy appointment. For me, I went into it, other than the cancer, relatively healthy, so my counts were great. I was able to complete chemo for the first time, and then I was able to actually complete all of my chemos without any issues at all. But as far as my white blood cell counts, that first time, they were pretty high. But then during the first couple of appointments with AC, they gave me this patch kind of thing that has like a box. So it's like think of like a Band-Aid, like a big Band-Aid, and it has a box maybe about the size of like 1.5 inches by like 1.5 inches, and it's called Neulasta, and it sticks to the back of your arm, or I think they can also put it on your stomach, but I'm gonna get it on my arm. And it has this little like weird kind of needle in it, but it's like a plastic piece. And anyways, it kind of helps with your white blood cell counts while you're going through chemo. I had that a couple of times in the beginning, and then I didn't have it after that. So hopefully if you get something like that, it won't become a surprise to you. It is something that I think, sorry, there was a bug on my on my camera. If you get some kind of a Neulasta or whatever medication they have at that time, hopefully that will help you to be able to complete all of your chemotherapies as well. So the first appointment, again, going in around noon, getting blood work done if needed, and then the nurse would ask me for my last name and my date of birth, and then I would walk back with my bag and my husband and my tea that I had just poured myself, and usually they would already have a station set up for me. The place that I went to was kind of a larger area, but you know, if your place is small, you know, you might have more of a choice. There were a couple of times that I wanted to sort of be in the corner or like by a window. Usually they could accommodate me, but at the place that I went to was pretty large, and they had, it didn't feel like, you know, I was a burden or that I was being looked at or anything like that. There was kind of like divider walls, which I liked, but because it was so large, there were a lot of nurses that would be there, and so they kind of all had sections. So so I walked back and I was sit down. The nurse that I had, she was so sweet. I really liked her a lot. And it was just kind of one of these things that she was the first nurse I had that gave chemo. And then after that, I was just like, oh my gosh, like I hope I have her every time. So I'm sure that, you know, had I had another nurse, I probably would have felt that way about her too. But there's just something that, you know, that you just place a lot of trust in somebody, and you know, they're telling you about the medications. So, you know, it's just a bond, as silly as that sounds. But, it's just so interesting to like think back. It's been, you know, a little over a year. Today is June 12th. So, I started on May 1st. I started chemo on May 1st. And, you know, no, I'm sorry. I started chemo on March 1st, not May 1st. But, you know, so it was just like seeing that person for 4 months. You know, even though I sometimes had a different nurse, I always really liked when I had her, because she, you know, she was just that like kind of first person to be there and walk through that with me. So but anyways, so the first time it's scary because you don't know what to expect, and it's scary because you don't know how you're gonna feel. You know, you think, you know, you of course read about chemotherapy and you think, am I gonna lose my hair, you know, after this very first treatment? Am I gonna, you know, become so ill that I can't be with my family? But I hope that that's not the case for you. I know, for myself, I was just scared that I wouldn't be myself. So, and I would say that without a doubt, cancer changes everything. Excuse me. Anyway, so, you know, if I can say anything about that first treatment, it is scary because you just don't know. So I hope that you get a nurse that is really lovely and walks you through all the steps like she did with me. So the first thing that they do is, like I was telling you about that cream, you know, you take off that plastic wrap, and then they spray if you want. They'll spray you, which I said, yes, definitely spray me. You know, I didn't want it to hurt. I don't know what, you know, it's gonna feel like. So they sprayed, and then so she came by with a cart that I had to basically sign to say that I wasn't pregnant, because some chemotherapy can really harm a baby if you're pregnant, and so of course they don't want to do that. So I signed a form saying that, and then she brought out the cart for me to start with my chemo. So they go back to the to the pharmacist, and they bring back your medications, and the medications that are distributed are specific to you. So they have a nurse come who verifies, okay, medication, you show them your wristband, they look at the medication on the vial, they look at your wristband, and then or the bag, whatever, you know, whatever it is. Some of them are vials, some of them are bags. And then you know, they just kind of do that like two-person type of verification. So that's kind of nice to know that hopefully, you know, there won't be any mistakes. So you're first set up with saline. So if you don't know what saline is, it kind of just helps to hydrate your body, hydrates your, you know, your artery that your port might be in, or your veins, you know, wherever they're gonna kind of put the chemo in. And it also helps, you know, so that you don't get too sick, because if you're dehydrated, that's how you can become sick. And so then after the saline, they usually put in a couple of different medications. Sometimes they'll kind of start with a medication that, for me, made my vagina feel like I just pissed myself. And then it also gave me this weird, like, tingly feeling at the top of my head. I'll link the name of it below. I wrote it down. Doxycycline, I believe, is what it's called. But I'll write the name below. And it's I asked, well, the nurse, she was so sweet. She said, I will push this very slow. Excuse me. And I said, okay. And so she was kind of talking me through it, and I said, oh my gosh, like, what is that? And she said, where do you feel that? And I told her, and she said, oh, okay. She said, in the future, she said, tell all of your nurses that you want this specific medication pushed slowly, because it will help to kind of alleviate some of that. Because some nurses just kind of push it quickly without really thinking too much about it, because for some people it's okay. But for others, it needs to be pushed a little bit slower. So then next up was the actual chemotherapy. So AC is red. You might see some things, it's called the red devil, because it's super, super potent. And the biggest part about it is that there's two things. Number one, the red devil is part of the reason that you lose your hair so quickly. So because it is so aggressive, it is a medication that causes a lot of people who receive this medication to lose their hair very, very fast. They might not lose all their hair, they might only lose hair in some areas. Some, like a very tiny amount of women or men do not lose their hair at all. But yeah, so, and typically hair loss won't start until the second treatment. Sometimes it does start before then, sometimes it starts a couple of treatments later, but typically most people will see hair loss and things related to hair loss that second, like kind of that second week of the second treatment. So the first treatment, I didn't lose any hair, but I had cut my hair. That was really important to me, was to cut my hair. AC is a medication that will rapidly cause the hair loss. There's probably other ones that do too, but for me, this is the one that made me do that. So the first appointment, so they put in the doxycycline or whatever, and then the chemo medications came. And all of this is put in through the saline bag. So you're hooked up through chemo, so you have this port. A lot of times they'll kind of just tape like a, I don't really know what it's called, but basically like the line, they'll tape it to your shirt. So wherever you're sitting, they'll kind of figure it out, and then they'll sort of just tape it so that way it's not in your way. And then most of the stuff is really just pushed through the saline bag. So you have a saline bag hanging. You'll have this box that just tells all the numbers of the saline and how quickly it's going through you, and you know, how long. Basically there's a timer, and you'll kind of hear a lot of beeps. And so for me, the AC went through my system really quickly because of that saline that they had very, you know, at first. And so I always had to use the bathroom around like 1 o'clock-ish, 1:15-ish. It was just something about it. Always had to go. So I would have to bring, I don't know what it's called, but that metal thing that the saline hangs from. I would have to literally bring that with me because I'm still hooked up, go into the bathroom, and it's a pretty long line as far as, like, you know, from the port to the saline bag. It's pretty long. So, you know, I'd wheel that to the bathroom, go potty, and then I would, you know, come back out, and then there was a second part of the chemo, I believe, that was given after that, and then I would get Benadryl. So the part about AC that they didn't really tell me was that my urine would be red. So it's red in the tube when they put it into the saline, or into actually that one I believe they just push right through the line, yeah, so it's red in the tube, and then when you use the bathroom less than an hour later, it is red in your urine. So that's really quite interesting. After I would go back and sit down, then I was usually given, I believe, the second part of the chemo, which, you know, I'm not a medical doctor. I don't know all of the names for everything. And then I was usually given Benadryl. So Benadryl makes me very, very tired when I take it in pill form. When I get Benadryl as an IV, it makes me very loopy, which I told them. So for me, I had to make sure that I always had a driver with me because it just would make me kind of silly, and just my whole body just sort of felt like, if you've ever taken pre-workout, that's kind of what my body felt like, this kind of prickly, almost like psychedelic type of feeling. One time I got really, really tired with it, but for the most part, I usually would just feel loopy, or like prickly. So that was my experience with my very first chemo. Thank you so much for watching my video. I really hope that you learned something about chemotherapy, if you are going to be going through the process, and I really hope that you are able to find the love for yourself and the kindness toward yourself to do what you need to do that's best for you.